Thank you, Doctor. Thank you, Dr. Sudhi Sariga and Dr. Mudal Sahani. And today is the 1795th day of the uninterrupted daily webinar of IFPH. Before beginning the session, there is an important announcement waiting for you. And our Vice President, Dr. Shaji Gudiyaj, is going to make that announcement. Sir, please.
Thank you, Dr. Binduraj, Dr. B.K. Sahani sir, and all others. So I am here to invite you all and bring to your awareness the 5 years of continuous uninterrupted Zoom meetings we conducted is coming reaching 5 years, and we are going to celebrate it in a very grand manner. We need all your support and participation. These celebrations will be held in Taj Vivanda, Cochin on 28th September 2025. It will be a one-day event officially, but those delegates coming from abroad and from North India, we will be having special programs after the event as you desire. So we appreciate all the faculties who presented in last 5 years. Please come forward. Let us have a big celebration of what we have achieved, which is a historically important thing. Nobody had done in the history of medicine, and we need to celebrate it. We invite all of you for this celebration. So there will be a delegate fee for that also. So the Indian delegates will be charged minimal to meet the expenses. So until August 15, there will be an early bird registration fees that will be only 3,000 rupees for Indian delegates. So we appreciate all of you should make use of this uh, minimal charges. It is a 5-star hotel, and we are just charging the food fees from there only. So we appreciate all of you to should join so that we can meet each other, and the wonderful day achievement can be celebrated. Those who wish to accompany the main delegate, they need to pay until August 15, 2,500 rupees. From August 15 to September 20, the delegate fee will be 3,500 for the main delegate and 3,000 for the accompanying participants. And from September 21 onwards, it will be considered as a spot registration. So it will be 4,000 rupees for Indian delegates. For foreign delegates, until August 15, it will be $200 as delegate fee. And from accompanying person, it will be $1,150. And from August 16 to September 20, it will be $250 for the main delegate and $200 for the accompanying person. So then after the September 21 onwards, it will be $300 till the date of the celebration, considered a spot registration. So we appreciate. Please make the early bird registration, and so that the minimal fees will be accommodated, so that we can have maximum participants joining us for this grand big celebration we are organizing. And please share with us your extra interest in coming to Kerala, which we call God's own country. Lot of surprises and beauties and cultural events are awaiting you here, and natural beauty is also there. There are good homeopathic medical colleges well established. We are planning to bring you over to the different colleges in Kerala so that you can see the facilities there. These are considered one of the best in India and, of course, in the world, specifically functioning for producing homeopathy doctors. So that's all for the special announcement today. And regarding the registration fee, it is to meet the event expenses plus the food only, the travel, transportation, accommodation, and the extra activities that we are planning to organize all need to be paid separately, or you need to meet it accordingly. This is only for the one-day event. For the food and other facilities we will be arranging to make this event happen. Thank you all. We expect all of you coming from all over the world and also from different parts of India, because this is a historical moment. Nobody had done it. Nobody had achieved such a historical mission and vision. So let us celebrate it so that we have achieved these great heights. Thank you all. Over to Dr. Binduraj.
Thank you, Dr. Shaji Kuriyat. And we are all expecting you to Kerala. And a detailed brochure will be circulated tomorrow itself, isn't it, sir?
Yes.
So let's start the session. Before starting the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1795th day of uninterrupted daily webinar of IFPH. And today's our guest is Dr. Nikunj Trivedi. He is the homeopathic physician at ATTENDEES Clinic, UK since 1980. And ATTENDEES Advanced Clinical Homeopathic Center. Dr. Nikunj specializes in treating fertility problems and chronic diseases and has authored 4 books on the subject. He received his degree with a gold medal in homeopathy in 1980 from India and has 43 years of versatile clinical experience. He obtained further training in medicine, gynecology, and surgery and started his own private practice. He is a fellow of the British Institute of Homeopathy. He is a fellow of Royal Society of Health. He has been awarded as Man of Achievement in 2002. He is affiliated with many homeopathic organizations around the world. He is a board member of Homeopathy for Children Charity UK. He had been honorable lecturer in the Department of Clinical Therapeutics at Homeopathic Medical College, and he teaches homeopathy. Dr. Nikunj has published many articles and research papers and conducted many seminars and lectures in the field of infertility and homeopathy. He has treated more than 2 lakh patients in his 43 years of clinical career, which includes infertility and chronic diseases with dazzling success over India and across the world with his online clinic. Dr. Nikunj Trivedi began his career as a medically qualified homeopath, ranked first in university, and has been practicing homeopathy since 1980 in India and from 2004 in the UK. Nikunj specializes in treating fertility problems and chronic diseases and has authored 4 books on the subject. He is currently serving as a chairman of the UK HMA. Dr. Nikunj has held several charity clinics and regularly participates in the Homeopathic Awareness Week. He also runs sitting in clinics and clinical training sessions for students and homeopaths. And today's our subject is understanding temporomandibular joint disorders, causes, symptoms, and treatment. Let us welcome Dr. Nikunj Trivedi for the session. And I welcome you all for the session. Sir, let's start.
Thank you, Binduraj sir, for allowing me to share my thoughts on the temporomandibular joint disorder. Am I audible?
Yes, sir. Well and clear.
Okay. Yeah. So temporomandibular joint is very small joint, but it is very vital joint in our day-to-day routine life. As soon as you wake up, these joints start into its action by yawning. If we don't have enough sleep, we start yawning, and the involvement of this temporomandibular joint comes into the action. Temporomandibular joint itself suggests its meaning. Temporo means temporal bone. Mandibular means mandible. So it's a union of temporal bone and mandible, which makes a joint, and that is a articulation between upper and lower jaw. Here I would like to share my PowerPoint presentation with you, so it will give you all a good understanding. So am I allowed to share my PowerPoint presentation?
Yes.
Okay. And when TMJ, when temporomandibular joint gets involved with any pathology, it always comes with a orofacial pain, pain in the oral cavity and with the joint. So it always present, patient always present with something wrong with the mastication, means chewing, speaking, breathing, sleeping, and facial expression. Many diseases that we have come across in our day-to-day routine practice, and as per Hahnemann's law, Hahnemann's teaching, Hahnemann's narration in the Organ of Medicine, Hahnemann has advised us to be a good observer. So we have to observe the patient, and we are taking the subjective and objective symptoms from the patients. And here, the movement with the mastication, the movement with the speech, that is called the linguistic and phonation, the movement of the respiratory muscle, that is breathing, and inspiration and expiration. Sleeping is also one of the important factor to be considered for the TMJ disorder. And later on, we will discuss with different medicine as well, and facial expression. So these all are very, very important and vital dysfunction that we can point it out from the temporomandibular joint disorder when patient comes to us for complaint of all the things which I have discussed earlier about the eating, speaking, breathing, facial expression, etc. So this is a most complex and complicated synovial joint. As I earlier said, that itself, the name itself suggests temporal bone and the mandible. It connects the mandible to the temporal bone, and it also covers the loads and loads of nerves that I will show you in a diagram. The joint between condylar head of the mandible and the mandibular fossa of the temporal bone, which forms the joint. It acts like a sliding hinges which allows various jaw movement. And important crucial function is mastication, that is chewing, linguistics, speaking, and breathing. So when patient comes to us, patient comes with a complaint of drooling of the saliva. The drooling of the saliva shows that the muscle of mastication is not properly functioning. And the muscle of mastications, there are 4 muscles of mastication, that is temporalis, masseter, lateral pterygoid, and medial pterygoid. These all muscles having a nerve innervation, and the major important nerve is auriculotemporal nerve with this. So when the auriculotemporal nerve gets involved with any pathological issue, inflammation or any pressure or any damage, demyelination, then it results to show such type of different TMJ disorders. So let us have a look on the temporomandibular joint. So when this diagram has been taken with the jaw closed. So upper and lower jaw has been closed, and we can see the articular tubercle over here in a mandibular fossa, articular disc, and joint capsule. So this gives an idea that when jaw is closed, how it looks. And how it looks on the side, on the lateral view. So this is a temporomandibular joint. And how it looks with mouth open. This is mandible. This is upper jaw. This is lower jaw. And these are the nerve innervation with the temporomandibular joint. The important nerves are passing, important cranial nerves are passing through the temporomandibular joint, nearby to the temporomandibular joint. And this involvement of the nerve can cause a lot of pathological outcome with the TMJ disorder. Actually, this is a subject of dentist. But recently, I have been invited to give a presentation on temporomandibular joint disorder by a faculty of homeopathy in UK. I'm an active member of the faculty of homeopathy, and I presented the same thing with all the dentists. And they found how homeopathy is working on temporomandibular joint disorder. So this is very important table to remember with every homeopath, with every medical doctor, and with every dentist. The key facts, what we know about the temporomandibular joint, we should know the articular surface. There is temporal bone, mandibular fossa, and articular tubercle of the mandible. That is called the condylar process. And what is the main component, as I discussed about it, that is synovial membrane. It's a synovial joint, articular disc, anterior and posterior band, intermediate zone of the mandible and the temporal bone. Ligaments are very important because ligament is holding the joint. When ligament becomes lax, laxity of the ligament. These symptoms we find in a sepia. Laxity of the ligament, all the muscle fibers are lax. And sepia is the remedy for the laxity of the ligaments and the muscle. There are so many other remedies, ruta and everything, but sepia having a very good clinical importance that I have noticed in my practice. So cavities, the superior cavity, that what we have earlier seen in the diagram. Superior cavity, that is discotemporal, which is responsible for translational movement, that is forward movement. Inferior cavity, that is discomandibular, which is responsible for rotational movement. So this all about the joint mechanism, that how joint works on articular surface, what are the main components, what are the ligaments involvement, what are the cavities, what about the rotational movement like elevation. When we open the mouth, the jaw gets elevated, and the main muscle which is responsible for the elevation is the temporalis, masseter, and medial pterygoid muscle. Depression, when we drop the jaw, that is depression, that is the muscle which gets involved with the lateral pterygoid, digastric, gynoid, and mylohyoid. So these are the muscle gets involved, and these are the muscles which is supplied by the auriculotemporal nerve and other nerves around the temporomandibular joint. Now, translational movement, that is protrusion. Here, lateral pterygoid, middle pterygoid, masseter, these three muscles gets involved. And with the retraction, posterior fiber of the temporalis over here. Deep part of the masseter, it gets involved. So that's why the jaw gets lifted, contractions and relaxation takes place. So common causes of temporomandibular joint disorder. Main is the injury. So straight away, nobody gets injured on the jaw unless and until they get involved in a fight. But jaw trauma is a very common iatrogenic condition. Iatrogenic condition means caused by physician, caused by doctor. Not a single doctor can cause straightaway harm to the jaw. But the dentist, when any patient goes to the dentist, and when dentist makes the jaw to keep the jaw open for a prolonged period of time by doing short of a root canal or any other procedure, then this joint is compressing the nerve. This joint comes under pressure and patient gets injury to the ligament, injury to the joint capsule, injury to the nerves, and then it results in a short of a jaw trauma and patient starts getting some symptoms of the TMJ disorder. So injury is direct injury is only with the fight or some accident, then and then it can happen. But the heterogenic cause is the dental treatment, or any surgical or maxillofacial surgery or anything which has been causing a sort of overstretching of the jaw, then it results in a jaw trauma. As you know, the degenerative arthritis, with the advancement of the age, we have been a degeneration of the joint, degeneration of the joint capsule. I would like to share one photo over here that what I'm treating a 192 years old lady having this degenerative jaw arthritis. I'll show you the photo on my iPad, so by that way you can come to know. She's a Spanish lady. She's 92 years old. She's unable to open her mouth. She went to the dentist. Dentist has done a lot of manipulations, but ultimately she was remain unsuccessful. And after that, she was on a puree diet. She is not able to chew the food. And with the muscle of mastication, she is not able to suck the puree diet, liquid food with the straw as well, because these muscles gets involved. And then she was given a shot of a protein powder just to drink. So there was a severe massive nutrition deficiency to her. And with that, she felt weak, she felt tired, and she had a severe disease spells. And that disease spells was leading her to get admitted in a hospital. They gave some drips and everything. Patient came back. But again, patient, the same problem. She was not able to use the muscle of mastication because of the degenerative arthritis. Here, looking to her condition, looking to her vulnerability to catch any sorts of viral infections, and already her brother is a doctor in Spain. So he prescribed some medication. With that, she was feeling a bit better, but not 100%. And with that, she was brought to me that if I can help in some way, I started with the cipilinum, 1 dose in a 500 ml of water. So she should finish the whole medicine in a span of 1 day. After a couple of days, she started feeling better. Cipilinum is a medicine to prevent the degeneration. And she had a degenerative arthritis of the jaw. So she started feeling a bit better. Right now, she's also under my treatment. Unfortunately, I can't find that photo on the iPad, so I'm sorry for that, but we will proceed with another thing, that is jaw malignancy. Misaligned teeth or misaligned jaw create uneven stress on the TMJ. These two joints, temporomandibular joint and alignment, when there is a disalignment and constant friction causing a constant irritation, and that constant irritation is causing a sort of a predisposing factor for the carcinoma. Simultaneously, oral hygiene is also one of the responsible factors. When patient is getting older, patient is unable to maintain the oral hygiene, and that misalignment of the jaw, poor oral hygiene, constant irritation is always leading to the malignancy. Now we are discussing about the anatomy and function of the temporomandibular joint over here. So mandible and temporal bone connection is very, very important. As I explained, that temporal bone and the mandible, it connects. And that jaw movement is responsible for speaking, for the mastication, for the chewing, for the sleeping, and facial expression. See, if we take an example of Parkinson patient is having a mask-like face. Patient doesn't show any expression on the face. All the muscle of mastication gets involved. So patient having a drooling. When patient try to drink, the drink comes out from the corner of mouth. The food comes out from the corner of mouth. When patient try to chew, patient unable to chew that. Patient difficulty in swallowing. So this all about the incoordination of the movement of the muscle of mastication, muscle of deglutition, and jaw movement. Cartilage and disc function is also very important. When there is a smooth movement, of joint without any problem, patient can get good tone with the mastication. Patient can chew very well. Patient can swallow very well. Patient can speak very well. Patient doesn't have any problem during sleep. Patient doesn't have any problem with the facial expression. But when the cartilage worns out, when the dysfunction is poor, it doesn't allow joint to function the way it should. And the role of joint capsule is also very, very important. Because joint capsule encloses and providing stability during the jaw movement. Now, role of the TMJ in jaw movement. When we open and close the mouth, that is called the mandibular movement. So TMJ allows the jaw to open and close smoothly, enabling mouth function. If you want to chew something hard, like cracking a nut with the teeth, the temporomandibular joint has enough amount tone, so we can break it. But when there is a lack of tone, we can't. The same with the chewing function, sliding movement of the TMJ, because when we chew, we roll the food inside our mouth, inside the oral cavity. And with that, saliva get mixed up, the bolus becomes soft, and we are able to swallow it smoothly. So the sliding movement is very, very important part of a TMJ movement and speech facilitation. TMJ movement also supports speech by enabling flexible jaw movement, positioning for sound production. Okay. How the TMJ interfere with surrounding muscle and ligaments. TMJ support role is very important. Muscles and ligaments around the TMJ provide essential support to maintain joint stability during movement. The muscle of mastication, as we discussed earlier, that with the anterior movement, with the posterior movement, with the inferior compartment that is responsible for the rotational movement, and a depression that is movement of opening mouth, and retraction, elevation. These all are important movement which has been taken place by all the oral muscles like temporalis, masseter, lateral pterygoid, medial pterygoid, and the movement of mastication is facilitated by infrahyoid and suprahyoid. So this jaw movement control coordinated action of these muscles and ligaments enable smooth and controlled jaw movement, and that's very important part of the TMJ disorder which we should evaluate while examining the patient. I had one patient when I was practicing in India. I had one patient was not able to close the mouth. So initially The general practitioner diagnosed as a trismus. I was also being called over there. That gentleman is a brother of chairman of Amul Dairy in our Anand. Amul Dairy is Asia's largest dairy. And the patient was a sort of a VIP patient, so I was also being called. And I checked the oral cavity with the putting the two fingers in the mouth, and there was a disalignment of the joint, and joint was dislocated. So that was not trismus. We have ruled it out. So by placing the two fingers, we try to put that joint back to the normal position, and ultimately it has been settled. But patient had a history of severe migraine, and that was because of the constant pressure on the nerves, because of the slightest laxity of the temporomandibular joint. And that we have fixed later on with the help of our homeopathic medicine. Now, causes and risk factor of TMJ disorder. Stress and jaw tension. Everybody has sort of some type of stress. And I always say that before life begins, stress begins. It is a part of infertility. When I treat patient of infertility, and when patient having azoospermia or oligospermia or patient having anovulation, I always consider this factor, that stress. And I always say that before life begins, stress begins, because there is only one womb, only single womb, and there are multiple millions of sperms are running to pierce that ovum. So stress begins from that point. So here also we consider stress and jaw tension. Stress causes muscle tension, leading to jaw clenching, increasing TMJ disorder risk. When we having a anger and we are unable to express that anger, we clench our teeth. Even in subconscious state of mind, during sleep, many patients, they clench their teeth. Dentists label that condition as a bruxism, means grinding of the teeth. In adult patient, we should not ignore the worms. In children, it is very common, worms, roundworm, hookworm, enterobius vermiculus. There are loads and loads of different type of worms. And that worms can cause a bruxism in a children. But when patient is adult, when patient having some latent anxiety, latent fear, some suppressions, we should always ask in detail. I had one lady patient from Milton Keys, which is nearby to my place where I'm practicing, about 50 miles. So she had a severe bruxism. And that bruxism was so getting irritated to family members. So nobody would like to sit around her. And also she had a habit of chewing a raw rice. A handful of raw rice she used to put in her mouth. So we put two rubrics over here. One is bruxism and second one is pica, abnormal appetite for the abnormal things. Nobody would like to eat raw rice, but because she was getting a so pleasure by crunching it, that was bruxism. When I took a history in detail, I found that she wasn't happy with the marriage. It was forced marriage. And all the time she was just trying to protest, showing her protest in her subconscious state of mind. And she was doing grinding of the teeth. And that we call the bruxism. So history is very, very important. And grinding of the teeth often during sleep contributes to the TMJ in a children and in adult patient also. When we don't find any solution, we should always consider the worms. And if we give our homeopathic anti-helminthic like Sina, Sabadilla, Calcarea, patient gets better with that. And genetic predisposition. This is also very important. inherited genetic factors can increase susceptibility to TMJ disorder. But I haven't come across any patient having a genetic predisposition. I have come across the patient having either injury to the jaw, that is trauma. And we have to also look at the differential diagnosis as well, that we will discuss later after this slide. Symptoms and diagnosis of TMJ disorder, and typical symptoms: pain, clicking, and limited movement. This is also very important. Tenderness is also we should consider. We can give the symptomatic treatment for the tenderness at the joint by involvement of the inflammation of the sign of the joint. Clicking or popping sound. When patient opens the mouth, it clicks, and sometimes it irritates the family members. Restricted joint movement, limited ability to open or close the mouth, reflects restricted jaw mobility and a possible joint problem. So these are all typical symptoms: pain, clicking, and limited movement. Sometimes you find patients with a difficulty in speech, difficulty in swallowing, drooling of the food comes out from the mouth, no facial expression, and sometimes very typical tinnitus, noises in the ear. This is very, very important. So we have to identify the high risk group, especially women, young adults, and with the prior jaw injury. They are at the high risk of TMJ disorder. In India, I have seen many patients, they are in habit of having a khaini or tobacco chewing. They chew the tobacco. They chew the betel nuts, sopari. That constantly causing a short of a jaw movement, TMJ movement, that can also lead to the submucous fibrosis in the oral cavity. That can also cause a short of a indirect injury to the temporomandibular joint. And in Western country, even India also, I've seen that people, means youngsters, they having a habit of chewing gum. They want to keep something in their mouth. Another new trend over here, that is vaping. They don't smoke, but they vape. So that is also one of the factors which can cause the submucous fibrosis in the oral mucosa, and that is also causing a sort of a restriction of the movement of the jaw, and it is also causing a sort of a TMJ disorder nowadays as a new causative factor. Clinical examination is very, very important. We examine our patient by putting our two hands on the temporomandibular joint, telling the patient to open the mouth and close. If we feel or if we hear any clicking sound, we just diagnose that you have some TMJ disorder. So with the observation and with the manual testing by a healthcare professional, even nurse can check it, we can check it, GP can check it. Patient history is also very, very important. Reviewing patient history provides context, and it helps identifying underlying cause and underlying issue of the TMJ disorder. Yes, on investigation point of view, imaging technique, X-ray and MRI scan. X-ray will show the wear and tear to the joint. X-ray will show the degenerative arthritic changes. X-ray will show if some osteophytes are being produced and which can causing a short of a restricted joint movement. So these all investigations are very, very important. Yes, as I discussed about the differential diagnosis. When TMJ disorder affect the joint, causing pain, dysfunction, and may resemble other conditions. It may mimics like TMJ, but it is not a real TMJ. Either it could be ear infection, otitis media, otitis interna, and that ear pain is also causing a discomfort and it may resembles or it may mimics like a TMJ disorder, though it is not TMJ. Dental problem, the molar, impacted molar, causing a severe toothache. That is also resulting and representing that is a TMJ disorder. There are so many neuralgias, but the trigeminal neuralgia is the worst condition which patient can face. And this neuralgic pain is also affecting all the muscle movement of the mastication, deglutition, and it looks like TMJ disorder, but though it looks like it, but it's not TMJ disorder. Treatment option. So in allopathy, there are surgical intervention. Surgical procedure can help repair or replace damaged joint in severe or persistent condition to restore its function back. It is expensive, and again, it can lead to a fibrosis, and there is no any certainty that it can last how long. Another treatment is a ganglionic block. They give an injection of xylocaine to the ganglion, and ganglion gets blocked, so patient doesn't feel any pain. But there is no any guarantee for the muscle movement. So ganglionic block is also a sort of a temporary relief to the patient. Advanced therapies option complement surgery by enhancing joint recovery and improving long-term outcome. So how we can stop, how we can prevent the long-term management, how we can prevent relapses, that is stress management and habits. Stress is everywhere. Stress is ongoing. But to manage stress is very, very important. So patients are getting engaged with the yoga, some relaxation exercise. They are avoiding jaw movement by minimizing pressure on the temporomandibular joint, having a soft food, having a puri diet, less speaking, less moving the jaw, and the thing which can trigger up that we call the obstacles, the cure, that we have to identify, and accordingly we have to advise the patient to avoid such type of obstacles which can trigger up the TMJ disorder. Teeth grinding, the bruxism that we have discussed. If any patient has some suppressed emotions, bad effect of exploitation, bad effect of humiliation, or some anticipatory fear, we can treat that thing with the help of homeopathy by going deep into the root cause of that condition. Say, for example, bad effect of shock can be treated very well with the ignatia. Exploitation, humiliation can be very well treated with the staphylos aureus. Like this means we have to find out the root cause of the condition, and accordingly we can treat the suppressed emotions, bad effect of exploitation, etc. But when there's a teeth grinding, and that is because of the worms, we can treat patients with the antihelminthic. So we have to manage the patient for long-term monitoring and follow-up care. So importance of regular checkup is very, very vital, very, very important. We have to call our patients regularly to check whether patient having still that condition or any improvement is there. We can give some medicine to improve the motility, movement of the jaw movement. So regular checkup is very, very important. And with that, we can ensure the detection of early changes in TMJ disorder. Whether patient is deteriorating, whether patient having a clicking, whether patient having a tinnitus, whether patient is drooling, when patient having some food comes out from the mouth, that we can monitor regularly if we check patients regularly. And we can adjust the treatment plan. Consistent follow-up allows for necessary adjustment in treatment to improve the patient's outcome. So this is all about the management. Now, we are coming to the very interesting homeopathic part. And we should consider the clinical aspect of homeopathy. In homeopathy, we have a very good remedy to repair the nerve. That is hypericum, spigelia, macphos, verbescum, and arsenicum alba. So these are 4 or 5 remedies which I am using in my practice whenever I get a chances to treat or to come across any patient having a TMJ disorder. In UK, we have to visit dentist regularly. And with every visit, dentist always check your teeth by keeping your mouth open for at least half an hour to clean it. So as we go with advancement of the age, while coming back from the dentist, we are also bringing some TMJ, pain, discomfort. And with that, many patients, they are complaining after visiting dentist, I got some clicking in the jaw. With the visiting dentist, having some tinnitus. So these are the things which homeopathy is always there to treat it. So clinical aspect with the correcting the TMJ disorder is hypericum, spigelia, macphos, verbescum, arsenicum album, and my most favorite remedy that I will discuss later. But if we are repertorizing any patients with the TMJ disorder, then you will find the rubric TMJ disorder in a chapter of face, pain, jaw, joint. In a repertory synthesis, you will find face, pain, jaw, and joints. And joints, lower articulation, temporomandibular joint syndrome. You can see here. Joints, lower articulation, temporomandibular joint syndrome. Right? And then there are so many remedies as per the rubrics it has been given. That's on the right side, which medicine is good, on the left side, which is more effective. When patient gets aggravation in the morning, patient gets stitching pain, patient having a burning, patient get burrowing, patient having a complaints aggravate with the chewing, everything is being given over here. Patient having a tearing pain, different type of pain. Then there are different type of medicine. Because very important thing I want to share with you, that TMJ is a unique as you are. We all are unique. Dr. Hahnemann has explained this thing, a concept of individualization. No two things are alike. Every patient is unique. Every homeopathy is unique. Every homeopathy is very potential. I can learn from every homeopath. I am ready to learn from every homeopath because every homeopath having their unique style of prescribing. And that is really fascinating me. And that's why TMJ is unique as you are. What works for one person, it will not work for another. So managing TMJ is very important. It all depends on how you treat the patient, how you go in depth of the patient history, and accordingly you can treat the patients very nicely. And when there is a orofacial pain, always look at the DD, means differential diagnosis. And now we are going to another slide. Here you can see full-fledged temporomandibular joint syndrome. In a synthesis, repertory, synthesis, chapter phase, and you will get the temporomandibular joint syndrome. You will not get this rubric in any other repertory except synthesis. That what I have searched. And as I explained you earlier, that my favorite medicine is causticum. Causticum, Hahnemann's tinctura acris sine cavi. Hahnemann has proved this medicine. And you can see the picture of Hahnemann, that what I have put in my slide. And all the complaints starts with the exposure to the cold. Patient cramps in the joint, temporomandibular joint. Masseter muscle is going in a cramps. Patient can't chew. Patient having convulsions, but that is epileptic. It is not related with the TMJ. But as it is with the C, so I have put it over here. Patient get chorea, that is neurological condition. Control over the sphincter, complete loss. So patient doesn't have control over the oral sphincter. So water comes out and food spills out. Complaints get worse by thinking over it. Constant fear, injurious effect of fear. And that fear, this is very important while going to the dentist. Patient doesn't want to go to the dentist because of the invasive procedure. Patient having a cough with raw soreness, must swallowed, cold water relieved her, and vocal cord paralysis, that is aphonia. TMJ disorder having some effect on the vocal cord with burning, rawness, and soreness. Another medicine is colocynth, as it is relieving cramps. And the colocynth is a medicine for neuralgia. This is neuralgia. So colic causing patient to bend double, that is abdominal colic. But when chilliness associated with neuralgia, patient feel feverish with neuralgic pain, whether it's a trigeminal neuralgia or whether it's a TMJ disorder. Colocynth will relieve patient within no time. Constrictions, contractions of the muscles, jaw muscles get under constrictions. Patient having a cramps, clamp with iron band. This is very typical. Patient having a restricted movement over the jaw. Patient can't open the jaw, and when patient opens, the jaw remains open. Other symptoms is not related with this, so I am not going in detail with that. That is copious menstruation, cystospasm, canine hunger with beta test, and cystic tumor in ovaries. That's not important with the TMJ disorder. Hope you have enjoyed.
Definitely. Thank you, sir. It was a great session. As TMJ is unique for everyone, the class is also very unique. Excellent. So it's the time to interact with the speaker. Let me welcome Dr. Manoj.
Thank you, Dr. Indra, Dr. Nikunj Trivedi. Definitely a nice session. And what is more important, this once again reiterates the fact that homeopathy is a totally practical system of medicine. Without going more to technicalities, we can simply give a relief to the patient. There are a lot of persons are always suffering with these complaints, but there is no relief, no solace, only advices. But what is the specialty homeopathy is that beyond advice, we can give medicines, the remedy.
Yes.
Very wonderful session. Thank you, sir, for the presentation. Thank you.
Thank you, Dr. Manoj. Let me welcome Dr. Ram Pravesh Sriram. Doctor, you can unmute.
Any question?
You, Bindu Raji, and Namaskar Manoji. Congratulations,
Thank you.
Dr. Nikunj Trivedi, sir. Very nice,
Thank you.
excellent session. TMJ disorder. Important, important disease and anatomical disorder due to many kinds of suffering diseases. Very, very thanks. Excellent session, sir. Thank you.
Thank you. Thank you. Really appreciate all your support. And so far, you all have enjoyed. I feel very much delighted that I can give something unique to our IFPH community. Thank you very much.
Thank you, Doctor.
Dr. Bindra, let me ask another thing. Yes. Sir, I think Ignition is also a medicine because biting while chewing the cheeks. Ignition is a...
Ignatia, yeah. I mentioned about Ignatia,
Okay, okay.
but I have not given full picture because
Yeah.
within a short period of time I have to finish. But
Yes.
suppression of emotions, grinding of the teeth, everything. And that's why I told that every homeopathy is individual in concept of individualization. So suppression of emotions can be treated very well with the Ignatia. Sina is also there. So you are right. You are right. Ignatia is very good remedy. Yes, Dr. Hubat, how are you?
Fine, doctor. Doctor, you are always keeping some new thing to us because in the previous time, in the first time of when you appeared here, I was very much excited by hearing your classes because you are every time you are keeping a new one, new things. So this is also a guideline for us. Thank you, sir.
Really appreciate that by heart.
Okay.
We are sharing the platform and we are learning new things from everyone. Every homeopathy is very potential. Even simplest thing gives a good clue to treat patients in a different way.
Thank you, Doctor. So it's time to conclude the session. On behalf of IFPH, I thank Dr. Nikunj Trivedi for this wonderful session. Please come with more topics, sir. We are waiting for your sessions. And
I'm always ready for IFPH. I'm always ready.
Thank you, sir. We are very much privileged. Thank you. And I thank you all for attending this session. And it's now time to start the Malayalam session and over to Dr. Shaila for the Malayalam session. Just a minute. Make you the co-host.